The Kipco School for the Deaf was established on November 9, 1970 to provide formal education to hearing impaired children of school-going age. The blind were later added. Ever since, the school has had to grapple with challenges with little support from government. The school, which solely relies on government subvention to feed the children, says the delay and the release of funds from government is greatly undermining the smooth running of the school. So this is Kobina Aferi Yamwa, who was just talking to us about the numerous challenges they go through. The quality of the food that is given to them is very poor. For them, they have no reason. They don't know why it's like that. But what they know is that they're actually given poor quality of food at the dining hall most times. For example, feeding the students has become a big challenge.
I just kept the date because it was 20th September or November. 2017, yeah. We ate some small beans and it was very bad. No one ate it because it wasn't good for us to eat. So we only collected the gari and went away.
The school's infirmary is also suffering as 6 students cannot be treated for lack of drugs. Ruth Kwara, a student, talks about her experience.
You go to the sick bay and they only give you paracetamol. I went there and they say in my house maybe I bath well. So the reason why I came here and bath pipe, that's why I'm reacting to that.
So when they gave you the para, did they treat it?
No, madam.
So what next did you do?
Madam, I bought a camel and carbolic. Even that one cry, it has not cured it.
But the sick bay, they haven't been able to provide with the necessary drugs?
No, I even went there last 2 weeks and the nurse was like, always I come there, so I should take a set and go home to treat it.
The untarred road leading to the dormitories poses a danger to the blind students, especially when they have to fetch water due to the breaking down of their only water pump. Primary 1 and 3 are required to share the same classroom due to the unavailability of classrooms.
Twinkle, twinkle, little star.
Twinkle, twinkle, little star. How I wonder what you are. How I wonder.
Poorly done. Okay, let's look at it. Let's go. Twinkle, twinkle, little star. Let's go.
Twinkle, twinkle, little star.
For the visually impaired, the embosser, which is supposed to convert the printed textbooks into Braille, has broken down for the past 3 years.
We have some machine here that transfer the print to Braille, but they said, I came here last October. They said it has been broken down since. We have not repaired it, so our seniors who are in the inclusive school, unless you get a sighted person to read for you, if not that, it means the whole term you cannot copy notes.
You have to scan the print. When you scan it into the computer and you edit. After editing, you use a software called WinBraille to convert the print into Braille, and it will be in a software. It is not hardware. And after you have converted it, then you now instruct the embosser to emboss. The embosser is just a printer. So when you instruct it to emboss, the embossing head is here. So when it is embossing, the head moves up, left, right, left, right, left, right. Whilst it is doing that, it will be pushing the paper. So the paper will be coming out, 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 out. By the time the paper is out here, all the work will be embossed or printed on the paper for the blind to use.
The authorities are therefore calling on government to intervene and provide the subvention as early as possible so they can pay their debtors and provide the required food for the health and safety of the kids. They are also appealing to individuals and philanthropists to come to their aid. Ajwa Adibia Owusu, TV3, Cape Coast.